Hello, and welcome to animatedteeth.com and our page that discusses routine postoperative swelling that may follow having a tooth pulled. In this video, we'll discuss issues that we feel are important to be aware of when managing this complication. That includes steps that can be taken to minimize the amount of swelling that forms, and also those that can help to speed up how quickly it resolves and you finally return back to normal. By the way, in this video we frequently use the word edema, which is the more formal term for swelling. As preliminary information, we'll start off by pointing out that there's nothing unusual about experiencing swelling after a procedure like a tooth extraction. Swelling is a normal bodily response when tissues have been traumatized. What occurs with any one person will vary. But for each individual, there's a general correlation between the level of surgical insult inflicted during their procedure and the level of swelling that subsequently forms. For example, following a routine extraction, meaning one where the dentist was able to wrestle the patient's tooth out quickly and easily, no appreciable level of post-op edema may form. However, there are several factors that can increase the level of trauma created during the extraction process. This includes pulling teeth that by nature are comparatively more difficult to remove, or those whose procedure will require an extended period of time to complete. Also, if additional surgical steps are required, like raising a tissue flap or removing bone from around the tooth, the level of insult rises, thus making edema more likely to form. So, if pulling your tooth was a quick, simple, straightforward process, then the formation of post-op edema may not be much of an issue for you. But at the other extreme, like when having a lower impacted wisdom tooth pulled, you'd be naive to think that some level of swelling won't form. If you've had teeth pulled before, you may have an idea of what to expect. Of course, the other expert in the room is your dentist, and they'll no doubt advise you about what's likely to occur. So, take heed. Something that's interesting about postoperative edema, and different than with other post-extraction complications, is that it's treated differently at different points in time. The normal timeline for surgical swelling is one where it will gradually continually increase in size until reaching a maximum at around 48 to 72 hours following your procedure. Then, from that point it should slowly diminish, with most people noticing full resolution by day 7 or sooner. Due to this two-phase timeline, a patient's management of edema needs to involve two separate sets of instructions. The first is composed of actions that can help to limit the amount of swelling that forms. And then, once it has peaked, the second set of directions is implemented as a way of helping to bring down that which has formed as quickly as possible. As you probably know, the first phase of edema management is centered around the use of ice packs. In fact, your dentist may have sent you home with one. The general idea is that cold applications constrict the blood vessels that service the tissues where your swelling is forming. This reduction in size limits the volume of fluid they can transport, thus limiting the amount of swelling that forms. The treatment process for this phase is simple enough. It involves the use of some sort of cold pack. This could be a bag of ice, a pre-packaged reusable cold pack, or even just a bag of frozen corn or peas. The cold source is wrapped in a dish towel and then applied to your face in the area of your extraction site and developing swelling. The pack is applied in multiple cycles throughout your day, but only during waking hours. The cycles should run for 15 minutes on and then 15 minutes off. The dish towel wrap, on-off cycles, and waking hours applications are all devices used to make sure you don't damage your tissues by exposing them to cold extremes. So, be mindful because you'll be numb for a portion of this treatment period. In general, cold application is considered most beneficial when performed during the first 24 hours post-op, and then less so on subsequent days. Also, keeping your head above the level of your heart can help to limit extraction swelling. So, recline instead of lying down. Or prop your head up with an extra pillow or two. Once your swelling has peaked, usually between 48 to 72 hours following your extraction, moist heat applications can be beneficial in bringing down whatever swelling has formed as fast as possible. A hot water bottle, a microwaved moist towel, or a pre-packaged reusable heat pack might be used as heat sources. Wrap the source in a moistened dish towel. Test it so it's not too hot. And then apply it to the area of your swelling for multiple cycles throughout your waking day. 20 minutes on, then 20 minutes off. The principle associated with heat application is that it dilates blood vessels and therefore accumulated fluids, the swelling, will be carried off by your circulatory system more quickly. Remember, with both phases of swelling management, the goal is to treat the affected area, without causing irritation or harm. So, be sure to monitor your temperature levels and exposure. In a nutshell, that's most of what you need to know. Our associated page contains much more detail, so you should give it a read. And, as one last point, if the swelling pattern you experience seems different from what we describe, make sure to let your dentist know. Of course, in all cases, it's your dentist's instructions that should always be your definitive guide. And you should feel free to be in touch with them if you have questions or concerns. As your treatment provider, assisting you is not just their obligation, but no doubt one of their primary practice goals too. So, let them know if you need help. Good luck and goodbye.